Thanks, Claire, and thanks everyone. Thanks to the faculty for inviting me today. So I'm going to be talking to you about public involvement. So where would it be about public involvement? But as I said, my name's Pete. I'm the Senior Public Involvement Manager for Health and Care Research Wales. Been in post about 2.5 years now. So just to say, I'm not necessarily a researcher as such. I'm more sort of a practitioner, sort of getting people involved in different ways. But yeah, history of me, been doing it for about 10 years. Started off in the Wales Cancer Trials Unit, moved to Decipher, where I was working with children and young people, and then been in post for like 2.5 years now. So yeah, let me move across. There you go. So just overview for the next sort of 30, 40 minutes. So talk about public involvement in Health and Care Research Wales. I talk about market research as well, sort of public versus user research and the difference between the two, but there's a lot of similarities between them. I touch upon sort of rebel ideas and using like cognitive diversity and getting different teams involved, and then go into public involvement, sort of what to do it, why to do it, and how to do it. It's going to mix of practical examples and how and when to do public involvement with some theory as well, so why it's important. The theory, just to say, it's what I've learned and how it's helped me to involve people from different backgrounds and community groups within Wales. It's going to be a mix of sort of interactive elements as well. So we've got some Menti questions, so there's some slides, and to use the chat box as well. But without further ado, this is how we work in Health and Care Research Wales. So we are, you could argue, we're like a recruitment agency for members of public and researchers. So researchers come to us in healthcare. They want members of the public to help shape this project, and we develop a advert with them, and then we advertise it to our public involvement community. So we've got, the community is made up of 500, 600 public members, and these public members apply for the opportunities as well. That's it really in a nutshell, as well as loads of other elements that we do with public involvement, but this is where we can link with researchers and public members. Just go to the next slide. So what we've got here is a Mentimeter question. So what I'm going to do is pop in the chat box a link to Menti. What we wanted to do is just answer, just get your level of everyone's understanding of public involvement. So if you want to head to that link that I just popped in the chat box and click on what is your understanding of public involvement. So 1 being basic, then expert, 10 being expert as well. Give it just a minute or so. Okay. Got a bit of like a above average understanding. So we'll be flicking back and forth between these Menti slides and the presentation as well. All right, okay, we'll go with 6. That's decent. So we've got a decent level understanding of public involvement. So it's another interactive question. It isn't a trick question, but in the chat box, can you tell me what this is? And also, can you tell me what are some other names for this? It's honestly, it's not a trick question. Yep, loaf of bread. Loaf of bread, yep. All loaf of bread, white bread, definitely. Any other names for bread? Different types of bread as well. So you've got, yeah, baguette, you've got ciabatta, you've got white loaf, you've got sourdough. If you move on, again, can you tell me what you see here? So what are some of the few things that bread can be used for? Yeah, sandwiches. So yeah, we got bread and butter pudding, we got sandwiches, we got breadcrumbs, and then we got migas, which is like a Portuguese, Spanish sort of dish as well. This is a tenuous link, but what I'm getting at is there are a number of different names, a number of different terminologies, a number of different ways that you can use bread. And that's the same for public involvement. There's loads of different terminologies for public involvement. You've got public partnership, public contributors, PPI&E, public involvement, research partners, and loads of different ways that members of the public can be involved in research as well. So they can be involved in designing the methodologies, sharing the research findings, helping the data collection. I'll go into more detail of different areas within the research cycle. But what I want to emphasize is that There's no one specific way of involving members of the public in the research. It fits what your research needs as well. So yeah, tenuous link, should I keep that or should I get rid of that? I think it works all right. So this is just a definition of public involvement. So public involvement in research means research that is done with or by the public, not to, about, or for them. It differs to research participation because this is where participants take part in study, and public involvement is also different to engagement as well. So this is when you're informing people about your research, but you can get members of the public involved in this because they would help you share your research as well, and it links and reaches a different audience as well. Kind of three broad categories or classes to public involvement. So at the sort of entry level, you've got the consultation. So this is where you are meeting with a public group or member of public as a one-off activity, being asked for their views about, patient information sheets, sort of changing the questions on there. At the other end of the spectrum, you've got user-led. So this involves members of the public as equal partners throughout the research cycle, including they'll be developing the idea and collecting and analysing the data. And then sort of middle area is the collaboration or co-production area. So this involves public advising during several stages of the research cycle as well. So just head back to Menti as well, so link in there. So this is what we're going to do, is a little sort of prioritization ranking exercise, which demonstrates the importance of public involvement. If we can go across, what we want to do is rank these public health topics, priorities in order of least important to most important, 9 being the least, 1 being the most important. But we want to flip it to put yourselves in the shoes of a young person. So a young person in Wales is aged between 14 to 25. So what do you think are the most important public health topics for young people in Wales? We spend like 1 or 2 minutes doing this, and then I'll show you some findings what a young youth advisory group have put down. This sort of exercise helps demonstrate the importance of why it's important to ask public members for their opinions, because you might have your own preconceptions of what members of the public think, but actually when you ask them, it's totally different. Okay, so we got smoking, vaping at the top, closely followed by mental health and well-being. We give it 1 or 2 more minutes. Take a photo of this. So we got sexual health at the top, or mental health's gone up there now. Well, okay. Right, that's staying open, but we'll move on. So if we have a look at this next slide, so this is what young people put as their priorities. So the least important priority, they put physical activity and exercise, closely followed by nutrition and diet. Then the other sort of 3 ones are smoking, alcohol, and drugs, sort of life. And then most important is mental health and well-being. So as we look at what you put as what you think young people prioritize, sexual health being the most important. And the next one is bullying, with mental health and well-being sort of being the 3rd most important public health topic. So it just demonstrates the importance of going out to the young people or going out to the public members and asking them for opinions, because we've already got their preconceptions of it. So yeah, speak to your audience, speak to the public members that you want to involve in the research, because it's important. This is just sort of few reasons why. So good public involvement is sort of worth investing in. It can lead to the development of high quality research and makes it easy to recruit and retain patients and members of the public. This is because the research is more likely to be designed and conducted in a way that is acceptable to them. It increases the relevance, understandability, and acceptability of projects as it provides knowledge and content. The research policy as well as indicating involvement of public is good practice. We've also got like an involvement as a requirement as well. So many funders like ourselves involve a requirement for public involvement in design, conduct, and dissemination of health and social care research. We do this because it makes research more relevant, define what is likely to be acceptable to patients, particularly in controversial or sensitive research, improves the informed consent process, so it makes it easier for participants to understand the research and potential risks and benefits. It improves the experience of research, participations in research as well. And it checks like the practical elements as well to make sure it's appropriate, and then improves the communication of the findings to the wider public. So providing information on the progress of the research as well as like the final results. These are just a few quotes that we've received from members of our research community who've used our public involvement service. So why it's important that they've involved it as well. So I just read the smaller one. The public involvement in development of the application was valuable. The public contributors brought a unique perspective that enabled us to co-create what we believe to be a very strong application. And I'll talk more about the service that we can provide later on as well, and how we can help you get members of the public involved in your research. So this may seem like a bit of a tenuous link, but the reason why I've included market research and user research is there are many crossovers between them and public involvement, albeit in different topic areas and focuses, but it all falls under the same umbrella of research. So both provide valuable insights into behaviours, needs and preferences. However, conducting poor or inadequate user research or public involvement can lead to sort of misguided designs, methodologies, poor decisions, study outcomes, and sort of unsatisfactory user experience or inadequate health care. I'll touch upon sort of few of the largest sort of marketing fails out there and why they failed as well. So these are a few examples where marketing campaigns have failed due to lack of sort of user research or public involvement. So the first one is Pepsi, which is Kendall Jenner in a TV spot. So they try to promote Pepsi as a product that's something that brings something together. So they got Kendall Jenner and they got her involved in this advert to have a settle a Black Lives Matter standoff between protesters and police officers. Understandably, this missed the mark massively, causing a lot of anger and criticism. And there's a huge reputational damage as well. And the CEO quit after 6 months, and he cited this as the reason for it. Second one, Dove body positive packaging. So they released like limited edition packaging designed to present diverse representation of bodies. So their packaging sort of compared figures to abstracts, shapeless soap bottles, but this kind of sent the wrong message, as they only released like 7 different shapes to choose from, forcing people to choose 7 shapes that match their body. Instead of sort of reinforcing a strong body image, it ended up increasing sort of self-consciousness. And then McDonald's did a sort of UK TV spot as well. So they, in 2019, they did an advert which shows like a young boy talking with his mother about his dead father, showing that one of the things they both loved was a fillet of fish. There was a lot of backlash for this, as it sort of exploited grief to sell their burgers. And then the final one is the Audi wedding commercial. So this is a commercial where the groom's mother walks up to the altar and starts checking out a soon-to-be daughter-in-law. Sort of pinches her lips, pulls her ear, opens up her mouth to inspect her body, and giving the nod of approval. And the tagline was, "An important decision must be made carefully." So Audi faced a lot of backlash by objectifying women and reducing the value to that of a vehicle. And it was far more offensive than intended. A lot of these marketing fails is they used a in-house team rather than external agency and working with external organizations. So it was more like an echo chamber as to why they thought this was a good idea. So these are some other sort of potential reasons why marketing fails or public involvement fails and they miss the mark. You've already may know some of them, but insufficient sample size, which is a big mistake. Getting public involvement, only asking a few people if they truly reflect the group you're interested in, the healthcare environment. If you make decisions sort of based on what a small group says, your results might not be fair or accurate. Biased recruitment as well. So another common mistake is recruiting participants who do not actively reflect the target user group, or using in-house teams. So this can be biased and skew the research findings. Leading questions as well. So if you ask questions in a way that pushes people to answer a certain way during a study, it can change their answers. Lack of contextual understanding. So if you don't think about people who actually use the product or the service in everyday life, you might make design choices that don't match what users really need. And we do a lot of this with public involvement when it becomes into the design stage of the research. So we ask members of the public how they think about the design of the research study, and are we asking the people too much if they're going to collect their information, or we need to make it more easier and understandable and user friendly for members of the public. And then confirmation bias as well. This is when people doing a study see the results in a way that matches what they already thought, even if the other evidence doesn't agree with it. So just a few reasons why this doesn't work. Some takeaway messages why this fails. So have clear objectives and goals, have a defined target population, and always proofread your projects. And they don't fall out of touch. Always consider the implications behind your project. And public members can keep you focused. We like to see public involvement as like the long-term impact and long-term reasons why you're doing the public involvement. One of the ways to increase the chance of success of a project or your research is the success of your project is by working with a number of different individuals and creating diverse teams. So this follows images from a book called Rebel Ideas: The Power of Diverse Thinking. It's by Matthew Syed. The book describes how to encourage like cognitive diversity and how you can help prevent making the above mistakes of the marketing fails we talked about. The book lays out this following image as a way to describe like cognitive freedom to express rebel ideas. And there's sort of 6 different teams here showing how teams function. What we're going to do is go back to the Menti, and we want you to identify which ones out of these 6 images do you think is a successful team that comes up with new ideas. So if we go across again, which team is the most effective for identifying new ideas, and then I'll explain a bit more. Five. Do you need me to show the image again? Here you go. I'll see what people are putting now. We'll give it a minute or so, and then I'll explain which one's diverse team. Okay. So majority have gone for team 4 and team 5, team 2, team 3. So I say it's team 5, then team 4, closely followed by team 3. Okay, fab. Thanks for that. So I'll go through each one of these. So image 1, this is a team of 1. It's an intellectual person. I think I would go as far as saying we're all of us in here. But we only know what we know, and we don't know everything about anything else. So yeah, that is not an ideal team to come up with diverse and rebel ideas. The second one is a team of clones. This is like collective blindness. So lots of similar intelligent people working with people who think in a similar way. It feels safe because everyone feels the same and shares the same views, but it limits the team's success. So when everyone thinks the same, they miss things they're not aware of. It's like being in an echo chamber, a bit like some of those marketing fails where they're not using external companies, they're using internal in-house design teams and not coming up with the rebel ideas and different ways of thinking. Image 3, it's a team of rebels. So having a diverse group of people isn't about being smarter, but it's about having a wide range of experiences and knowledge, when dealing with like complex ideas. It's crucial to collaborate with individuals who think differently. Number 4 is a team of sort of rebels without a cause. This, again, is a diverse group, but they don't have a clear purpose or a plan. They come together without a specific goal, direction, or purpose. So they're just in a meeting room for a meeting's sake. They're not focusing on one specific area. Number 5, which I think a lot of you put, was a diverse team. So this is rebels with a dominant leader. So you're in a diverse group, but it's led by a dominant chair. So there can be sort of issues with communication and hierarchy. The leader should encourage open communication and diverse ideas. And then number 6, so this is when the team begins to parrot a leader. So there's no room for diverse or rebel ideas, and our diversity is lost. So it's come together and it's moved across, and you're all thinking the same there. So out of those six, number 3 is the image which illustrates a diverse team of rebel ideas, which would encourage rebel ideas. These are sort of few ways of how to encourage and welcome rebel ideas as well. So 3 things that you can do. Blind meetings. So it's difficult to remove name and job title and organization when you're on Zoom or Teams, and hierarchy from all meetings. But try do it and run the meetings based solely on suitability. So I know we tend to do at the beginning of the meetings, introduce ourselves. We can still do this, but I would recommend avoiding job titles. Include something that others won't potentially know. It could be something like an icebreaker, like a favorite meal or last film watched, or something informal that other people can relate to. The social care centres such as Care and Cascade do some brilliant icebreakers, and they remove the sort of formal structures that sometimes are in place. Create a culture of psychological safety. So we want an area where sharing ideas and trying things out is encouraged. So having diverse teams is pointless if everyone feels anxious about saying the wrong thing. So you want to allow for anonymously sharing of ideas. So we use Mentimeter quite a bit. So Mentimeter gathers people's thoughts or asks them to provide them before the meeting. I'm sorry, Mentimeter gathers thoughts anonymously, so we don't have any identifiable data. It's just the answers on the screen. Another way of doing it is asking people for their thoughts or their questions before the meeting as well. So we want them to be able to answer it without being influenced by others. And then avoid standardization. So the rigid and standardized processes and outputs may seem efficient, but they ignore the uniqueness as individuals. And often one size does not fit all. So you want to be adaptable with your meetings and how you gather information and feedback. Instead of sort of presenting what you want people to review or provide feedback on, we've embraced a sort of a different approach. We present the problem first and then encourage individuals to come with the solutions. Then we demonstrate how these solutions then align with our ideas. So this approach has helped us avoid the domination of rebel ideas by a single leader, which was that image 5 on there. So these are just a few ideas on how to do that. Research shows that teams with higher cognitive diversity consistently outperform normal teams. So these teams approach problems from different angles to support more issues and see more unique solutions. And they also foster innovation and bring in new ideas and build on them. So something new and unanticipated. So we want you to deliberately increase the mix of backgrounds, knowledge, skills, experience, thinking styles, and personalities. And this is where public involvement can come in, and this is where they can help you address and increase the cognitive diversity and the rebel ideas within your research. So a few things why it's important: improve decision making, enhance creativity and innovation, greater adaptability and flexibility, improve team performance, and better understanding of customers' needs. So this does link back to public involvement, and there are similarities between the two. And if you talk about public involvement, so when you should do it, we've talked about why public involvement is important, some theory behind diverse teams, but not gone into the practicalities of it and why you should do it. So first and foremost, the early in the research, the more important the findings you have in your project. And by definition, the earliest you can do something on your current project is today. So do it right now. Do it at all stages as well, and we'll explain. There's some usefuls to learn in every single stage of the research plan. And each research step will explain the value of your project by more than the cost of the research as well. And do most public involvement early in the project. So work with members of the public to identify, what's the project plan, how they can get involved throughout the research, and we can support and advise you on that as well. Okay. So we use the next few slides to explain why, how to do it, and how we can help you to do public involvement using the research cycle. So we go through each 7 steps, talk about why it's important, how you can do it, and how we can support you to do this. So in the first step, identifying and prioritizing, is considering the most projects are funded by public money. It's important that the public voice is able to inform what is being researched. The knowledge of patients, the public, and service users can inspire sort of unexpected research questions, and it allows the researcher to check the priorities that have already been identified and relevant to the people of the research. So how your research can benefit and how you can benefit as well. So it helps you inform research priorities, identify new topics for research, increase likelihood of funding, maximize pathway to impact, and it can give you greater insight into patient or public opinion on your research proposal. Ways to involve them. So you can access support from Health and Care Research Wales, you can contact local user groups or listen to people's own experiences and unmet needs, peer group interviews, surveys, and interviews as well. Sometimes it's difficult for people who are unfamiliar with research to identify the research questions. So begin by understanding the challenges the individuals face in their daily lives due to the condition, treatments, or access to services before discussing how these might be turned into research questions. So we supported the Wales COVID Evidence Centre. So they did a research prioritisation exercises using a James Lind Alliance methodology. We recruited underserved community groups to help shape the prioritisation exercise. So we met out with these groups to identify what barriers are there to COVID, what are the questions that still need answering, and how can the Wales Evidence Centre answer these questions. So this fed into their primary research, which they've been able to get further funding to establish a new centre called the Wales Evidence Centre as well. So we've been able to do that identifying and prioritisation exercises with them. You go across. So commissioning funding. So many funders like us incorporate public members into funding panels. They're there to review applications and offer feedback. So this practice provides a better perspective by considering the viewpoints of public and their patients. So it's important to involve public members in the application process as well. It's essential for ensuring the issues are important to the broader community and is addressed as well. In here as well, we can support you with the Enabling Involvement Fund, which is a pot of money that we have to pay for public involvement during the bid development stage. So if you have got a funding application that you need public involvement to support, then we can provide it. There's caveats around this. I won't explain it now, but my email's at the end of this. So if you do have any questions, please fire away. So some of the reasons why it helps explore clinically important research, align research with public interest, gives greater credibility of research as well. And as I said, we have a funding board and there's public members who review the funding applications. So this is the design and plan stage. So we want to involve the public and patients in the design of the research. It helps to ensure that the research outcomes are clear and relevant, and that the research methods meet the needs of people taking part in the research and those who the research can benefit as well. So improved relevance, clarity and feasibility, the methods for people to actively involve in different stages, improves the recruitment process and the diversity of participants as well, and it can improve sort of interpersonal skills. The ways to do it, you give the public an active part in developing and reviewing your research tools like the patient information sheets, work with the public on your recruitment strategy, because they might identify different novel ways of accessing diverse, underserved community groups. Review the acceptability of data collection as well, so they could tell you, actually, you're asking too much of the patient when you're doing your research, or this is a better way of doing the research with the participants. And then they can provide sort of timely potential participants into the study and sort of timely follow-up as well. So you can help create written information that's easy to understand, specifically aimed at communities. They can help you plan a budget for involving the public in your research. They can make the recruitment process for recruiting participants easier because they've identified little practical barriers. And they can review your research protocol as well for potential difficulties or patient burden. Undertaking and analysing, so we've got the other stage now. So having the public and patient actively involved in the research team can make everyone more committed to the project. Their sort of personal experience in the research area can help gain a better understanding and understand the results more deeply. So there's a significant benefit of involving public as peer researchers. So consenting participants to the research study, they can carry out the interviews and run the focus groups as well. There's additional training here you have to need to think of for both yourselves and the researcher as well. So there's something to be aware of. The Wales Cancer Bank, or Wales Cancer Biobank, they have peer researchers to consent people to the biobank. It improves the honesty, reliability, and depth of the participants' response as well. So feedback about the treatments due to the sort of natural rapport that the peers have between themselves, and it improves the experience of the participants who may find the process less threatening if it's from a peer researcher. Got onto the disseminating stage as well. So just two more stages. So involving the public in this stage can help ensure you're communicating your work in a way that people can understand, access, and use. So involve the patients or members of the public in developing, sort of reviewing the dissemination strategy, the lay summary of findings, just to ensure that they're clear and accessible to all. So effective dissemination can also help identify the need for further research as well in like a particular area. So it leads to implementation and generate funding for further research as well. So many of our public members have supported research to present their findings. We recommend that researchers bring a public member to talk about their research at a conference. It kind of gives more of a flavor, more like real life examples of the public as well, and how it makes a sort of real difference. A few different ways that members of the public can help with, and ways that they can help get involved as well. And then finally, sort of implementing and evaluating. So members of the public who've been involved in research are often like passionate to ensure that something happens as a result. They often have existing relationships or being an established new one with key stakeholders and policymakers, which in turn, it can facilitate sort of effective implementation of your research. What we mean by this is public members can apply your research in real life settings. So they have the public involved in the research can help shape, support, and enhance your research as applied in real life. So involving the public in research often leads to changes and improvements in health and care practices that matter to people. Impact side of this, so the impact is relatively difficult to demonstrate, but we know we can support you with this, assist you in sharing what works and what doesn't work, and demonstrate the impact of public involvement. We encourage you to capture public involvement throughout the project life cycle and share learnings and impact of the public involvement. We supported a researcher who developed a public involvement research impact tool called PIRIT. This will assist you planning, reporting, and monitoring public involvement. So it's a one document completed by both researchers and public members. It's developed by the Marie Curie Palliative Care Research Centre as well as the Wales Cancer Research Centre as well. So this is a way that you can measure impact of public involvement. Finally, what does good public involvement look like? So the standards are designed to improve. So we got the UK standards for public involvement. These standards are designed to improve the sort of the quality and consistency of public involvement in research. They've been developed as part of like a 5 nations public involvement group over the course of 3 years, and they're like a description of what good public involvement looked like, and they're split into sort of 6 themes or 6 parts, each linking up and encourage you to think more about public involvement. Each standard, like each of these 6 standards, has a series of set reflection questions. These help you answer if you're demonstrating good public involvement. So first one is communication. So this is where we encourage researchers and members of the public to use plain language, well-timed and relevant communication as part of like the involvement plan. So we want you to communicate with a wider audience about public involvement and research using like a broad range of approaches that are accessible and appealing to the majority. When it comes to working together, it's thinking about different ways that you and the members of the public can work together that values all contributions and that builds and sustains like mutually respectable and productive relationships. Public involvement is better when people work together towards a common goal and different perspectives are respected. And we talked about, rebel ideas and the diverse teams. It's valuing everyone's opinion. Inclusive opportunities. this is where we want to offer public involvement opportunities that are accessible and that reach the people and groups according to your needs. The research needs to be informed by a diversity of public experience and insights, so it leads to treatments and services which reflects these needs as well. Impact, as I mentioned, we got the PIRIT tool. There's other tools out there. There's the GRIP 2. There's the Public Involvement Impact Assessment Framework. We want to seek improvement by identifying and sharing the difference that the public involvement makes to the research. You want to understand the changes, the challenges, the benefits, and learning gained from the insight and experience that the patient, carers, and the public bring to research. And if governance, so some ways that you can involve the public in the research management, regulation, leadership, and decision making. So public involvement in research governance can help research become more sort of transparent and gain public trust. And then finally, it's the support and learning. So it's identifying what offering and promoting support and learning opportunities that build confidence and skills for not just the public members, but for yourself as well, or for other researchers. You want to remove practical barriers, social barriers that stop members of the public and research professionals from making most of the public involvement in research. So we've got a workbook on our website with questions on this workbook, which you can use, and it helps you reflect if you meet the standards and how you can improve on your public involvement to meet the standards as well. Finally, just a slide on supports you can access for public involvement. So as I mentioned at the beginning, the public involvement opportunities. So we are like the recruitment agency between members of the public and researchers. We develop adverts that our members of the public will apply for. They submit an expression of interest, and we'll share these expression of interest with you. And then you can choose which members of the public to choose from. We have a Enable Involvement Fund, which is a pot of money that we can cover public involvement payments during bid development stages of the research. So when you are looking for a funding application or applying for funding application, you want public involvement before this stage, we've got a pot of money to cover that costs. We've got training and guidance as well. We can provide bespoke training to organizations and individuals, but we have training and guidance on our website as well. And also we have a public involvement engagement forum. The next one's on the 19th of March. And it's looking at our Discover Your Role action plan and identifying what are the barriers still around for public involvement and how do we overcome these barriers as well. That is it in a nutshell. So I'll stop sharing, but does anyone have any questions?